How do cultural beliefs affect attitudes toward mental health? Have you ever wondered how the way we think about mental health can vary from one culture to another? The truth is, cultural beliefs play a big role in shaping our attitudes toward mental health. These beliefs influence how mental illness is perceived, experienced, and treated in different societies. At the core, culture provides a set of values and norms that help people interpret mental health symptoms. In some cultures, mental distress is viewed as connected to the body, spirit, and social relationships. This means that emotional struggles might be expressed through physical symptoms or spiritual experiences. Healing in these cultures often focuses on restoring balance rather than just addressing psychological issues. Religious and spiritual beliefs are also significant in how mental health is understood. In many communities, mental illness may be seen as a result of spiritual imbalance or moral failings. This perspective can lead to treatment methods that include rituals, prayer, or guidance from religious leaders, alongside or instead of medical help. For example, traditional Chinese medicine and Indian Ayurveda emphasize harmony in both body and mind, influencing their approaches to mental health. Stigma surrounding mental illness is another key factor. In numerous cultures, mental health issues can carry shame or be viewed as a sign of weakness. This stigma often leads individuals to hide their symptoms or avoid seeking help altogether. In some communities, mental illness may be seen as a dishonor to the family, making it even harder for individuals to reach out for support. As a result, many people may rely on informal support systems like family or community elders instead of professional services. Social norms also shape how people view mental health. In collectivist cultures, where the needs of the community are prioritized, individuals may suppress their own distress to maintain harmony. This can lead to worsening mental health outcomes. On the other hand, in individualistic cultures that emphasize independence, people might feel pressure to meet high expectations but may also be more open to seeking professional help. Cultural competence is vital in mental health care. Mental health providers who understand and respect diverse cultural backgrounds can build trust and tailor treatments to align with patients' values. This includes recognizing different ways of expressing distress and being sensitive to the stigma that may exist. When we look at mental health through the lens of comparative religion, we see how religious teachings and community structures influence perceptions of mental illness. Many religions provide explanations for suffering and prescribe practices for healing, which can shape how individuals experience mental health challenges. In practical terms, mental health interventions that incorporate cultural and religious beliefs tend to be more acceptable and effective. This could mean working with religious leaders, including spiritual practices in therapy, or respecting traditional healing methods alongside clinical treatment. Understanding the diversity of cultural attitudes toward mental health can help reduce stigma, improve access to care, and support overall well-being.